Well, hi there, everybody. This is for MA200. This is our week 4, continuing on with our micro lecture in chapter 39 in your Cengage book. This is the PowerPoint micro lecture attached to that. This is specialty examinations and procedures. I want to talk about the MA's role in this lecture in regards to specialty exams. Um, we're going to recall various hearing and other diagnostic ear tests. We're going to talk about some of the things that we use for these specialized tests. These can be done in your general practices or your specialty offices too. So what are we talking about? Ear examinations, okay? Ear irrigation may be required prior to perform procedures. Um, a lot of times you're going to learn how to remove impacted earwax. So I'm going to send out some um, videos on that next week for you to watch and then send me back a video summary report on. Um, and it feels really good. I love ear washes. You'll be amazed sometimes when you are irrigating an ear and getting out impacted earwax and cerumen, how much a human being can have in their ear. It's outrageous. Um, I want you to know about these tympanic tests. Unless you work for an audiologist, unless you work for ENT, you're not going to be doing these in a regular general practice usually. Physicians like to do these, the tympanometry and the tuning fork exams. Yes, you should know how to do them. It's rare that an MA will perform those outside of an ENT office, ear, nose, and throat, or an audiologist office. Um, if you have to do these in a general practice, the physicians will usually do these because there could be some kind of a weird thing going on. Um, Usually, when these things are required, they will be referred out to ear, nose, and throat specialists. So, if you are working for an ear, nose, and throat specialist, you may be doing these things all the time. So, these guys are kind of hit and miss. These guys you will be doing all the time. The top two up here, the ear irrigation and the earwax, removing the earwax that's impacted, you will do those, and those are billable. So if you do one, you have to make a notation that you did it that day because that's something that we can bill to insurance. So don't just do that and not tell somebody. You want to let the doctor know that you did that because that's a billable procedure. Important to know. For eye examinations, again, these are for routine general wellness visits. If you have to have a yearly physical, you will be doing these. Um, but if outside of checking vision acuity or color blindness or color vision, um, these are things that the physicians will do when you're talking about doing these actual optical procedures. The doctor can look with the ophthalmoscope, but again, outside of a regular just a screening, if any of these issues are happening, the doctor will do them, applying ointments or tinctures or drops. But you still have to be able to help them. The doctor may tell you to do these things. But a lot of times, if you get into these more specialty things, these are going to be referred out to specialty offices. So, a lot of times, a doctor in a private PCP or primary care physician will look at some of these issues and go, based on these findings, I'm going to refer you to ear, nose, and throat or your eye doctor, ophthalmology. Um, it just depends on who you work for and how that goes. But please be sure that you are understanding of the different procedures that you can do. You may have a piece of something stuck in your eye, you just can't get it. You're going to go to your doctor's office or an urgent care. So we have in the offices special irrigation things that can help to dislodge any foreign objects that are causing inflammation or eye issues. And then the visual acuity, these can be really important because, these are like Department of Transportation mandates. If you have truckers that have CDL licenses, a commercial driver's license, these have to be performed in a well-lighted room with no interruptions. Um, you have to test them with their corrective lenses and without them. Um, in your book on table 39-1, this is for possible indications of visual disturbance. Um, the Snellen chart is for distance vision. The Jaeger system is for nearsightedness. Snellen is farsighted. Jaeger is nearsighted. So those will determine and assess which one is which. And then we have the Ishihara plates, okay? So these are to contrast the sensitivity screening. This can determine if you have color blindness. A lot of people may be colorblind and not even know it. It's really wild. But that's pilot or a commercial driver's license you're applying for as a trucker. Nah, you can't be colorblind to fly as a pilot. They won't let you. So some of these are mandated by law. Respiratory exams. The vital capacity is defined as that greatest volume of air that can be expelled during a complete, slow, unforced expiration. That's what we call breathing out, okay, following a maximum respiration. So a lot of times if you have patients that have trouble breathing, you can perform these spirometries, these peak flow testing, and pulse oximetries. Pulse oxes are probably going to be the most common thing that you're going to use to measure your respiratory status. If a patient is like a known asthma patient, you'll probably do these things. Patient has really bad shortness of breath, the doctor may say, let's do a spirometry on them. But that just determines how much oxygen a patient's getting on their own, just with a natural oxygen environment in the air, without like O2. Proctological examinations. These are diagnosing hemorrhoids, fissures, rectal ulcers. So no joking, all joking aside, these are painful. They can cause a lot of pain. Um, Everything that comes into contact with an inner body cavity has to be free from microorganisms. You are going to be responsible for maintaining and cleaning and disinfecting these instruments. A lot of times the doctor will just use a digit examination, like with a finger, to feel if there's any obstruction or ulcers or hemorrhoids, fissures, any of those things, because those are super painful. So for the proctological examinations, that proper positioning of patients is very important. You need to be able to prepare these patients with explicit instructions so they know what's going to happen. Imagine you're naked with a gown on and your dupa is up in the air on an exam table and your head's down. You're very vulnerable. So put yourself in your patient's shoes, okay? Think about how you would feel if you were the one that was having this performed on you, and then act accordingly, and you'll never go wrong. These are the sigmoidoscopies or diagnostic examinations, and those actually use a scope, and they go up to the interior of the sigmoid colon. Now remember, your colon has a ascending, transverse, descending colon. So depending on where it's going, this can show if there's any precancerous lesions, polyps, those kind of things. And it's very useful in the aid of diagnosing a cancer of the colon. Like I just said, ulcerations, polyps, tumors, bleeding, and any of those other lower intestinal disorders. But it's important that you talk to your patients. So you need to make sure that you are explaining all these things. Think about if you've never had one of these done, and you're nervous already going in because you're like, oh, whatever. They're going to give me some of that blackout medicine. Cool. Remember and think if it was you or one of your loved ones. There is no better place than in medicine for the golden rule. Just like my Jesus said it, okay? You want to treat other people the way that you would want to be treated, okay? We're caring for everyone with dignity and respect every time across the line. This is going to be hard to hear, but you are still going to have people that are going to test you and challenge you in ways that you have not yet even understood. We have to treat a patient that comes in with a swastika tattoo the same way that we would treat a sweet little old person that's just like, I don't understand. That's what we do in this profession. We treat everybody. Sometimes it's going to challenge you to the core fiber of your DNA, but we still have to treat everyone the way that we would want to be treated. That being said, though, you do not have to put up with any kind of abusive behavior from anybody, be it a physician, be it a patient, or a coworker, okay? Know in advance that you can still be kind and pleasant and empathetic and caring Yet, please don't let anybody treat you any way less than you will treat somebody else, okay? Just be mindful of that. You are in control of that examination room. Patient is under your care. Until the physician walks in or the provider walks in, you need to control the environment. This is your kingdom. They're just living in it. Now, again, they're also consumers. So if you treat them, or if a patient feels that they've been treated incorrectly, they will leave an email to your facility. Every time a patient comes in, they are offered and afforded a feedback. Just like you guys all do these midterm surveys on your instructors and your evaluators, you as a consumer, as a patient, can do that with your providers. So understand, if you have a bad day, and we all do, but you take it out on somebody and they send a strongly worded email, HR's coming in and they're going to investigate. It will happen, I promise you. So what I like to tell everybody is, lock your problems in your car for your shift. Leave them in the car and lock your door and walk away, because two things are going to happen. You still have to go in and do an 8-10 hour shift. And when you're done with your shift and you punch out, all of those problems are still going to be waiting for you in the car. But those problems inside your car, your personal problems, they're not your patient's problems. So don't bring them into the workplace. Promise. Best case scenario, you do it once, you'll get a verbal warning. That's it, though. In my facility, you bring your nonsense or drama into the work environment, your nonsense and drama is going to be walked out of my building. I don't have time for it. I have people that are, actively in crisis, and I cannot have your crisis adding on to our patients. That is true for nurses, physicians, MAs, and PAs. Leave your problems locked in your car, and they stay there until you punch out. Then they become your problems again. But don't bring them into work. That's not professional. And you need to learn how to make sure that you are regulating and self-regulating your emotions and your personal life so it doesn't bleed into your professional life. I'll say it one more time. You're not working at the Mill Creek Mall. This isn't, and there's nothing wrong with retail, but this isn't retail. This isn't hospitality. This isn't any of that. This is people's lives. This is people's health. Again, people are already coming into a doctor's office afraid of the cost, afraid of the answers, afraid of what's going to happen, fear of the unknown. You be part of the solution, never part of the problem. Okay? Please take what I just said into heart and re-listen to this again and write these things down, because you always want to be caring, empathetic, treating people with dignity and respect. Okay? And not bringing our own personal problems into the work site, because you wouldn't want that to happen to you. So really try to make sure that you're feeling empathy for your patients. Some of them aren't going to deserve it, but you still have to express that. Coping mechanisms, when you can have a whole dialogue in your brain and your head while you're talking to a patient. If they're really obnoxious, you can be like, I just want to kill you. You can think those things, but on the outside, you are smiling and supportive, and that is what they expect from us. It's a whole brave new world when you're doing healthcare. It's just not like any other kind of job. And it's a calling. This is not something that you just do to get a paycheck. So remember these things. They're important. And if you follow what I just told you, you're going to do great when you get out there. So thank you very much for attending my TED Talk. We'll talk next time. Make sure you write these down and save this, because this is the lecture for MA200, Chapter 39. Thanks, guys. See you soon.